Thank you, Mr. Chairman, and thank you to all of the witnesses for joining us and sharing your experiences and perspective. It's been tremendously impactful to hear from you. Mr. Chairman, I do want to note and acknowledge that we have a Georgia physician with us, and Dr. Verma. Thank you for your work providing health care for Georgia women at a time when the provision of health care for Georgia women is under attack by elected officials in Georgia. As you noted in your opening remarks, where one of the most extreme laws in the country has been enacted, a 6-week ban on abortion, which takes effect before many women even know that they are pregnant. In the midst of a maternal health crisis in our state. Mr. Chairman, I don't know if you've heard these statistics, but more than half of Georgia counties have no OBGYN at all. No OBGYN in more than half of the counties in our state. We have one of the worst maternal mortality rates in the United States. Even worse, much worse for Black women in Georgia. And a shortage of qualified providers of OBGYN care. And so, Dr. Verma, what I want to discuss with you as we consider the impact on human health of Georgia's extreme 6-week abortion ban is how this risks worsening our shortage of qualified physicians. I'm looking at data here from the Association of American Medical Colleges that new OBGYNs are much less likely to apply into residency programs with extreme abortion bans like the 6-week ban in Georgia. And I think we all recognize this, but Dr. Verma, these physicians provide the full spectrum of perinatal care. So what does the state's OBGYN shortage mean for Georgia women, please, Dr. Verma, based upon your professional experience?
Thank you, Senator Ossoff, and thank you for everything that you do for healthcare providers and patients in Georgia. So I am very concerned that the law in Georgia, our 6-week ban, is going to make the healthcare shortage worse and affect providers wanting to go into OBGYN and provide in Georgia. I have talked to multiple medical students and residents who say they aren't going to stay in Georgia because they don't want to be in an environment where they can't practice evidence-based medicine and have to worry about whether they are going to be criminally prosecuted, have their license removed, have their livelihood threatened. The same procedures that we use for abortion care are also used for miscarriage management. The same medications, the same procedures. And so I've talked to trainees who worry that if they stay in Georgia, they won't get the training that they need to take care of someone who comes in at 14 weeks bleeding heavily, that they won't be able to provide them with the emergency care that they need. We know based on survey data that 90% of OBGYNs have said that they've had a patient in the last year that needed abortion care, and the vast majority have gotten that patient connected with the care that they need, even if they personally feel conflicted with abortion, even if they don't provide the care themselves. So this is something that OBGYNs support. They want patients to get the care that they need, and they're worried that they won't be able to practice evidence-based medicine in Georgia and are leaving.
So, and just to be clear, because I think it's vitally important that Georgians understand this and that the Senate understand this. The 6-week abortion ban in Georgia, backed by threats of criminal prosecution and imprisonment for physicians. And we see in the data that these laws are deterring OBGYNs from pursuing residencies in states with laws like this.
Absolutely, and you're absolutely right that then affects not just, again, like I'm an OBGYN that does abortion care, but I also deliver babies. I do GYN surgery, I do cancer screenings, I do full spectrum OBGYN, as many OBGYNs do. So this is not just going to affect access to abortion care, it's going to affect access to all care, all reproductive health care in our state. I practice in Atlanta, where we've already experienced the closure of a major medical system that's having devastating effects on access to care in our city. You're absolutely right that half of counties in Georgia have no OBGYN. I expect this is just going to get worse.
Thank you, Dr. Verma. Thank you, Mr. Chairman.